discussion into the evolution of healthcare security with me, Tony York. I'm your host and going to be joined by a really wonderful guest today. I invite you to join me in learning alongside some of the brightest minds in the security industry as each month we take a deep dive into important topics surrounding the safeness of healthcare. Today's healthcare organizations are continuously looking for ways to improve security and patient care while being confronted with more disruptive and volatile events and behaviors than ever before. We've seen a changing societal climate that's placed even greater emphasis on individual training and tools to best manage and combat the possibility of litigation stemming from the way certain challenging situations are being managed by our security teams and our security staff. In this session, I'm joined by Alan Butler. He's a past president of IHSS. He's a current colleague on the IHSS Council on Guidelines, and he's the System Director of Public Safety and Security at Cox Health. And he's going to join me in discussing the benefits of implementing body-worn camera technology inside of healthcare. For those of you who know Alan, you'll join me in knowing that his experience inside of healthcare and his influence inside the industry is renowned. I've known Alan for well over 20 years, had a chance to work with him directly and closely, and he is a consummate healthcare professional who continues to give back just tirelessly, selflessly to our industry. So buckle in as body-worn cameras have shown to significantly reduce legal and reputational risk for organizations, and it's expected to be standard equipment in most healthcare security programs in the next few years. Alan, thanks for joining me and welcome to the conversation.
Oh, you're welcome, Tony. It's always nice to have a conversation with you and give back to our industry that both of us love so much.
Amen to that, Alan. And we have had our share of good conversations about our real favorite topic of healthcare security. But Alan, before we jump into the issue itself of body-worn cameras, tell us a little bit about Cox Health and the security program you administer.
Yeah, Cox Health is located in Springfield, Missouri, which is in the southwest corner of Missouri, pretty close to the Arkansas border. And we have 6 hospitals and about 125 clinics in the surrounding area. Cox is pretty unique. It's privately owned. It's a not-for-profit. And it's that hospital that I think all of us want to be able, or healthcare system that everybody wants to be able to work for. This organization is committed to the mission of public safety inside healthcare. They absolutely get it. And all of you know how difficult some of those conversations are that we occasionally have with leadership. And I feel really fortunate to have a leadership team that understands if we want to be an employer of choice, the first thing we've got to do is create a safe work and care environment. And they support most everything we do. And in a lot of things, we've been early adopters. We are a public safety and security department. About 30% of our officers are what we call post-certified, which means they're licensed by the state of Missouri to be police officers, and yet they're not. They operate under our umbrella. All of our officers are armed, and we have our own training academy, which is really pretty unique. As many of you know, we are armed with handguns, tasers. We wear body-worn cameras, as we're going to talk a lot about today. And we have canines on our team. And so we've got a little bit of everything. And our charge, pretty simply, is to keep our staff, our patients, and our visitors safe. And I think we do a pretty good job of it every day.
That's so great to hear, Alan, and to see the evolution of healthcare security happening right there in your organization. But I think I'm hearing you say a big part of that evolution is the leadership that the system is bringing to this important topic and the issue of how do we create a safe environment for healthcare.
Yeah.
You know, it's interesting to me to think about all the reasons that a healthcare facility might want to deploy body-worn cameras on their security staff, their public safety personnel. Alan, go back into history, go back into time. Why did Cox Health want to introduce body-worn cameras? Was it event-driven, or was it part of a bigger security master plan? What can you help us understand and how that evolution occurred?
You know, I think at the end of the day, it was part of a bigger security master plan. It was not event-driven specifically. I mean, we all have incidents that you look back and say, well, I wish I had one of these or one of those, or we'd done this or we'd done that. But this is Cox Health, very progressive in its approach to public safety and security, and body worn cameras just made a lot of sense to us. You know, Organizations, we all deal with risk management, and organizations will tell you that there's all types of risk. For Cox, the biggest risk has always been reputational risk. Um, can we afford a large lawsuit? Probably. Do we want to? No. What we can afford is that tick in the community, in a small community like we're in, and in the surrounding areas that hits our reputation. And so, body worn cameras were a big part of us responding to that potential reputational risk. Um, and they work very well in that sense. So I just think we were an early adopter of a technology that really makes a lot of sense.
Well, it sounds interesting to just think about reputational risk, and a lot of us in the security space, we think about those security risks. We think about what does it mean to keep that environment safe, and I think it's important that we remind ourselves how critical it is to keep that because the negative implications of something happening inside of an organization, issues that are occurring that we aren't really controlling the narrative or we don't have a full understanding of what's happening. That's, I think, an important conversation for us to make certain that as healthcare security administrators, we've got to keep that in top and center of our mind. But a lot of things I talk to a lot of folks, Alan, and I know in our earliest conversations when you first introduced the whole concept for the audience, Alan and I had a chance to tour ISC West last year in Vegas, and we were chatting a lot about the technology that we were seeing, and it was just a fun conversation. But then we got into where he's at in his conversation with the technology they chose. A lot of it was about deterring that live recording can have, especially on individuals that are behaving aggressively. Alan, have you guys been able to see that at Cox Health? Have you been able to see that you've been able to actually slow down, if not maybe completely mitigate, but really having a measurable impact on the actual behaviors of people that know they're being recorded by your security teams?
In some cases, Tony, I will tell you, and I think everybody in our audience understands that um, sometimes there is absolutely no logic or thought to the violence that we encounter inside healthcare. It's driven by the abuse of alcohol and drugs and mental health issues. And whether you're wearing a body worn camera or not, and you highlight the fact that you're wearing a body worn camera, in some of those circumstances, it makes absolutely no difference. However, especially we saw this during COVID when we moved um, the level of aggression to our entry points because we were denying people entry into our organizations, and we were telling them they had to wear a mask and you could only have this many people. We saw that level of aggression, like everyone else, I think, kind of ratchet up. And those people are not dealing with the same issues that we just discussed. They're just mad. They're aggressively mad. And so when we highlight to people that this conversation is being not only recorded, but videotaped also, we saw and we use that as part of our de-escalation technique. Again, it doesn't always work, but in many circumstances it does completely eliminate some of the aggressive behavior or at least tone it down. So yeah, we've seen that it does have an impact.
Isn't it so amazing? If we could get the judicial system to have a little bit of understanding of the difference between the intentional violence and the unintentional violence that we see inside of healthcare, that's a topic in its own right. And I probably don't want to sidetrack us too far, but I find myself thinking about all of the sentencing issues and everything else that we've done inside of healthcare over the last dozen plus years. And we really haven't done enough to really get those that are really making those sentencing decisions to truly understand some of the people we have are just showing their backside and showing their ugly selves.
Mhm.
Others are really in a behavioral health crisis, and we're seeing them at their worst and lowest times. How do we help them understand that is something I think that hopefully the body worn camera will be able to do over the course of time so that we can really truly minimize the impact of violence. But Alan, I can imagine that introducing technology such as a body worn camera inside an organization like Cox had to be a pretty involved process. I mean, I'm assuming it was multidisciplinary. So tell us a little bit about it. Think about those that may be listening to us right now that are saying, how would I introduce body worn cameras? Who do you think they should get involved in that decision making process? What reps? And maybe tell us a little bit about what you might have learned by having their engagement in that process and even in revisions that you've done to policies, I'm sure, since you first introduced the program.
Yeah, multidisciplinary is a really good word in this case because there are so many parts of the organization that are impacted by the use of body worn cameras. And so our risk and legal departments are joined at the hips, and they were at the top of the list. We have a great legal department. They helped us rewrite policy. Um, Policy is so critically important, and we'll talk more about that as we move forward. But when it comes to body worn cameras, you have to have a very good written plan for how your team will use those cameras, when, where, how you'll record it, how you'll keep it and store it, all the critical pieces. We also had to involve our IT team because
Mhm.
all this data sits behind our firewalls, and yet we're sitting on a vendor's server for video management. And you got to make sure that you're protecting this information because there is protected health information inside what you're going to tape. You have to have buy-in from your administrative team, your clinical team. Not only are you recording the patient or the visitor, it's not always an angry individual, but even in those situations when it is, you're also capturing clinical uh, team members. And there is the ability to evaluate clinical decisions that people make if someone were to subpoena your body worn camera footage. So you have to have buy-in at many levels. And finally, you can't ever leave out human resources because human resources is that group that will determine if the organization is willing to put that level of scrutiny on their employees as a whole.
Yeah, I mean, so much to unpack with that, those commentaries there, Alan. And it's amazing to me to think that, there's a lot of fear that goes into the body worn camera, right? I
Yeah.
mean, employee patient violations with privacy, etc. I know a lot of people want to throw up HIPAA and the first thing. But before we jump into some of that and maybe some of the other IT, did Cox introduce anything where they brought community-based groups to? I know with a lot of defensive equipment, I see it with conductor electrical weapons a lot where, if we're going to introduce the program, we want to get that feedback from those community groups. Was that something that Cox did for the body worn camera?
Not really, Tony. May have been a good idea, but we measure our community pretty continuously. I will tell you that we brought in outside law enforcement. We wanted them to know
Okay.
what we were doing. We have a pretty um, interesting relationship with, like many of you, we deal with multiple police departments, whether they're sheriff's departments and city police departments. And we wanted them to know the equipment that we were using. All of them are using the same equipment, what the guidelines were, how it impacted them. So it was really important for us to have them involved, but we did not go into the community outside of law enforcement and emergency responders to say, this is what we're doing. And what's interesting about what we do, and one of the things that allows us not to have that conversation is we're what's called a one party recording state, which means only one party has to be privy to the fact that there is a recording taking place. And in our case, that's the officer. He's the only one, or she's the only one that has to know. Now, there are some two-party recording states out there. I think there are 11 of them still. And in those states, you have to have signage on your doors that announce that there's a recording, and you want to make an introduction of the audio and video equipment when you use it. But that was not a requirement for us, and probably one of the significant reasons we didn't go into the community.
Yeah, I appreciate hearing that, Alan. And you introduced, while we were getting prepared for this conversation, a phenomenal article by Bill Marcise, who is an industry colleague within IHSS. And
Yeah.
for those who are listening, I just recently posted that, actually a little bit earlier today. And he lists out all of those 11 states that Alan just alluded to that are two-party recording states, and even gives some, I thought, some wonderful insights for how to best overcome using signage for video and audio, sort of scripting for what is happening with the officers themselves before they turn on the device and deploy it. But it is interesting, though. You're talking a little bit earlier about the equipment that law enforcement is using. And there are different manufacturers, right? I mean, I think working on similar platforms, and they've got their value propositions and each their own. But there had to be a rationale for Cox and for you all there about picking a technology manufacturer that you did. Al, talk to us a little bit about that. I mean, talk to us a little bit about why did you choose who you did? I think it sounded to me like in some earlier conversations, it was done with purpose and by design.
Yeah, it was. And our decision was driven by our existing video management system. We are a Genetec user as it relates to video management. And we use access cameras throughout our organization. I think we have, at last count, about 1,400 of them. And we're continuously updating our cameras, but we've always stayed on the platform of access cameras to Genetec video management. And that pushed us down the path of also using access body-worn cameras. And there was a very specific reason for that, because when we did that, we were able to use the same video management platform. Now, we had to add servers because we wanted additional space and storage space for our body-worn cameras, but we were looking for a marriage. And what we got with Genetec in this case was, let's say we have 3 officers involved in an incident, and they're all wearing body-worn cameras, and they're in the emergency department where I have fixed lens cameras. Well, when the incident is over and done with, and as we all know, video is used primarily as an after-the-fact tool, we have the ability to sync our video, both fixed lens cameras and body-worn cameras, and the audio, so that you can open up a large screen and you can watch this incident unfold on 3, 4, 5, 6 cameras at the same time. And so what you see on the front side versus what you see on the back side versus what you see body worn or fixed lens camera, they're all different, but they're all painting a picture of what's going on. The other thing that was important to us is we wanted to have, keep it simple, stupid kind of philosophy. We wanted it to be simple for our officers to sign out a body-worn camera and to redock it. And what we got are, each of our officers is issued an ID card. In this case, it's actually a fob. And when they start their shift, they go to the controller where the cameras are stored, and they use their fob, which identifies them individually. It in turn assigns the camera to them. They can't take the wrong camera. If they pull out the wrong camera, it chirps at them. But the other one that lit up green, that's their camera, and it's assigned to them. And so we have this a watermark on everything they do that night. When they're done, or in the middle of the shift, if they have a really tough incident they want to see, all they have to do is redock that camera into the controller, and all the downloading is done automatically. And from our perspective, that's that was really important for us too.
Yeah, so it wasn't really so much the manufacturer, it was the integration of how that technology worked with your already existing deployments, and there was some ease of use for your staff. Al, did you find that your own team had any reservations about introducing body-worn cameras?
It's funny. Our team really didn't. And I think part of that process is we did a really good job on the front side of communicating why we were getting body worn cameras. And even though at times it would be used as a training tool where you would capture something that might have been done differently or might have done better, the purpose wasn't to call out anybody. It was to learn from the video. But more importantly, we were able to convince our staff really quickly early on with a couple of big wins that the video that we were getting from our body worn cameras, it was like having, you know, we've all been there, the old he said, she said kind of a debate where someone says, well, the officer hit me. And the officer said, I never laid a hand on him. Well, now all you got this observer that looks over your shoulder. And not only do they record what happened, but they record the audio. And we got some early wins that were big. And our staff said, well, that's there to protect me. It's not there to hurt me.
Yeah, I would imagine that would have been something that had to be a little bit of an education on the front side, but once they really come to grasp that, hey, that's the case, we're not just trying to watch and be a scrutiny of every move you make, as much as saying, hey, let's make certain that everybody sees, especially in these kind of really concerning situations that we find our security teams get involved with, right?
Oh yeah.
Hey, I'm seeing a question come across the chat, and I'm paying attention to all, but when the current system that you have, if you deploy your conducted electrical weapon, will it automatically kick on? Does the officer have to do that themselves?
The officer actually has to do that. Ours is not tied to our tasers. However, our body worn cameras buffer video. And so, which technically means that the camera is always laying down video. It doesn't actually record it until you hit the button. But the minute you hit the button, it jumps back 30 seconds. So even if you were to deploy and quickly fire your taser, if you hit that button, it's going back 30 seconds, and more than likely it's going to capture the entirety of that tasing event. But the simple answer is it does not.
Yeah, and I do know that there are other manufacturers that have that, right? I mean, that's probably the pros and cons that I'm sure you and the team went through of saying, hey, what's the best decision for us? The one thing I have been just amazed on and is the continued evolution of video surveillance technology, the body-worn camera being right at the top of the lens. Uh, I've always said that was probably one of the biggest outcomes that came from what happened on September 11th, 2001, because all of a sudden the word security became something pretty common on the tip of a lot of tongues. And I think we started seeing form following finance. We started seeing the manufacturers realizing that, hey, let's put some investments. And we're starting to also see that those investments are not just in the security and protection space on this, but we're taking full advantage, right?
Yeah. Tony, I talked about a couple of early wins, and for the audience, I'll just say this. One of our early wins was a complaint that went straight to our legal department about an officer who had sexually harassed an individual. One of those type of incidents you were just talking about, Tony, that carries a lot of weight, has reputational risk. And we were able to, this gentleman was sitting outside our hospital smoking a cigarette. He wasn't supposed to be there. He was a patient. And the officer very politely approached him and asked him if, one, if he would put out the cigarette, and two, would he go back to his room? We captured that incident from the time he started to walk up in the beginning of the conversation until he walked him into the building, got on the elevator, took him upstairs, and dropped him off at his room. And we were very clearly able to say, None of that ever happened. It just didn't happen. We have both video and audio evidence of it. Our legal department, which might another circumstance end up spending 100, $300,000 just retaining attorneys to defend the hospital, simply said to the gentleman, they reached out and said, we have body-worn camera footage and audio of this entire encounter, and we don't see anything that you're claiming. Are you sure that this actually happened? It was the end of it. Never went any further. So that camera system paid for itself overnight. One incident.
And that's the one you know about. Probably not even
Yes.
all the ones that you don't. And what a great story, Al. I mean, as you start thinking about, now all of a sudden we're able to defend the actions. And we all know in this space, patient complaints are always taken seriously. We jump through a lot of important hoops to make certain that we are investigating those not only timely, but thoroughly. So, to me, one of the benefits you've just alluded to is how successful these programs can be just in your after the fact investigation of complaints. Some that might be, let's just say, maybe not as truthful as we expect. Others would probably say that they probably have a little bit of corrective action that you might need to find that you take on the heels of that. But Al, let's talk a little bit. Let's jump into the policy and procedure conversation. And I feel like this is something I know you and I have talked about extensively leading up to today. I know Bill put a lot of emphasis in his article and everything that the IHSS put together in the guideline they introduced back in the summer of 2022 explicitly. But right now, when is the body-worn camera expected to be used and deployed at Cox Health? I mean, give us some circumstances for just some guiding principles for the audience and myself.
Yeah, basically, we ask the officers to use the body-worn camera during any interaction with could be a patient, could be a visitor, could be a vendor, especially if there's anything unusual about that situation. For example, the obvious one is, you're going to have to do a patient restraint of some sort. Everybody gets that one. But let's talk about the guy who locked his keys in his car, and he wants you to Slim Jim the window. Well, isn't it nice to have it recorded that you're saying, well, I need you to sign this form, sir. Are you aware that if we break your window, more than likely you're liable for it? A very simple example of how the body-worn camera supports what we do every day, day in and day out. Slip and falls. How advantageous is it to have an up-close recording of the surface that the individual was on when they fell, and the statement they made, well, I just tripped over my shoes. I hate these old shoes, because 6 months down the road, when someone files the lawsuit on that particular, that's not how that conversation occurred. I mean, we've all been there. We know that. So we wrote our policy around, if it appears unusual, absolutely the stuff where you're putting your hands on people or you're telling a trespass, those are the no-brainers. But we really wanted to take advantage of it in every circumstance that we could. And the system allows us to do that. We have lots of video storage space. They last the entire shift, no matter how much you use them. And so there's no reason for our officers not to use them. And for the most part, they use them pretty frequently.
So not only patient interventions, negative security events, what I'm hearing is all your customer service interactions, all the things that you're doing to be of assistance and help, you're going ahead and saying, hey, record the interaction, record the circumstance, not to mention the waiver. Goodness, you just gave me nightmarish reminders about some of the old ways of somebody forgetting to get that waiver. Next thing you know, you're trying to foot the bill for some repairs on that electrical window that you just like, come on, really? We're trying to be helpful now. You're going to expect us to replace something that you did. But and I don't want to sound so facetious about that, but boy, I tell you, there are times when people do want to take advantage. So the body worn camera is there to help prevent a
Yeah.
lot of that, is what I'm hearing you say extensively. Now, I do know. I mean, there's some no recording rules, right? I mean, there's restrooms, changing rooms, employee break areas, places that we have
Yeah.
expectations for privacy. That that's like with anything that when we think about recording and video surveillance. But any other organizational restrictions for Cox about when the body worn camera should not be deployed?
Yeah, there certainly are, and you named a few of them. Those areas where there is an expectation of privacy associated with a restroom in particular, a changing room, a locker room, where there's a better than even chance that you're going to stumble onto someone who's in some state of disrobe. I will tell you that we have had officers with their body worn camera inadvertently on in the restroom. They only do that one time. It was not about who was in the restroom. It was the fact that they were in the restroom. So you only do that one time, and your coworkers have a good time with you, and then that never happens again. Um, but also, as we all know, there are situations that we get into where the state of undress is part of the situation. And I'll go back to patient restraints. You got a patient in a gown in, let's just say, the emergency department, and you're having a very physical struggle with them. During that time, our officers really pay no attention to the state that they're in. Their job in that moment is to get that individual under control so they don't hurt themselves or others. And as part of that, there are times when we record various states of undress, and it's pretty graphic. And the way
Mhm.
we protect our organization is we now consider that protected health information. It sits
Mhm.
behind our firewall. The only way you're going to get it is through a subpoena, or you're a regulatory agency that can get your hands on that. And you got to go through our legal department before that happens. We've not run into a situation so far where we've had to share video like that, but it, for for a policy to say that it'll never happen is a mistake. You have to say it is preferred that it not happen, but I promise you, there is going to be a circumstance where it happens.
Absolutely, Al. And my understanding is, I mean, everything I have studied and since the HIPAA law ever became effect, I mean, it's not the fact that we recorded it. It's who gets access to it. It's who's able to watch it afterwards. It's any violation that may happen. And I think it's important that, that whole mindset of who has a need to know, who has a need to watch. I mean, the officers experienced it. They were involved in that engaged in that circumstance. And it speaks so highly to me that it says, let's make certain that we still understand, hey, it's the fact that we recorded is not a violation. It's if we shared it inappropriately is the violation. People who did not have a need to know that we were to allow it to go out and the voyeurism that may happen with something stupid like that. I mean, but I think those are the things that we're still trying to overcome. I mean, I think it speaks almost to, well, can we actually even have a recorded video camera in a patient room? And I get asked this question all the time. Well, people say, can you? Well, it depends. What's your hospital policy say to it?
Yeah.
Because HIPAA is not telling us in the US that we cannot. I mean, there are certain things that we want to make certain that we're being very mindful of, especially for who can access that footage. But it's important. But
Tony, you just highlighted something that's really important and should be a very obvious part of your policy, and that is who views the video, when they can view the video, and in what environment can they view the video. Early on, it's been a couple years ago now, we had an incident where one of our officers was completing their report, and they went back to view the video on their body-worn camera to substantiate something. And as they were rolling through it, there was a clinical person who was standing behind them and recorded it on their phone. And so now all of a sudden we've lost the security of that. And we were able to quickly identify who it was and clamp it down, but it only takes a matter of seconds for things to go to heck in a handbasket. So it's really about who sees it, where they see it, how well is it secured. To your point, it's not that we took the video, it's that we shared it after the fact.
Yeah, absolutely. But I'd be remiss, Alan. I got to bring a little levity to the conversation that you brought up about the bathroom guy. It reminds me of listening to a speaker who was on break once and who was mic'd up, and next thing you know, he's at the urinal and just having a conversation, and everybody in the audience was there. So hopefully it wasn't embarrassing for your officers as it was for that particular individual. And
Yeah.
unfortunately, that guy had to speak for the next hour as opposed to being on the backside. So, but it is funny. I mean, because life is really what we're saying. It does happen, and
Mhm.
and because you have it. But all of that really speaks to something else, Al. And we're talking about sort of video surveillance and retention requirements. And what did you guys do at Cox to modify your retention policy? Is your body worn camera policy the same for all other deployed video surveillance, or did you make exceptions for it? Is it different? I mean, just walk us through a little bit of that.
I would use the term here, under promise and over deliver. Our retention policy as it relates to video, whether it's still camera video footage or body worn camera footage, says we will keep it for 30 days. Now, the reality is we loaded up with some enormous servers, and I, the other day, looked at video that was 5 months old that was still sitting out there. If it's an incident where we get some idea that there will be future litigation, whether we've been told there will be, or it's serious enough that we believe there might be, we then download that video, archive it in a secure file, and just save it. And I think that's what most people do. We're just very fortunate to be able to keep it for a long time. The advantage of having more than 30 days is, as we all know, some department manager is going to come to you and say, a couple months ago, someone was in my office and they took A, B, and C. And you're like, well, how would I don't have video footage for that. Why didn't you tell me 2 months ago? But anytime you have more video footage laid down for a longer period of time, it just provides you options that you lose when that video gets overwritten.
Yeah. Well, sometimes, I mean, the video can be damning, right? If
Yeah.
there's something that we're keeping it longer than our retention policy. But I'm also hearing you say that you have certain expectations of events, interactions that the officers are getting engaged. So there's
Mhm.
certain areas that you're saying, hey, that's going to be worth saving. I'm assuming you're saving those on networks that are there in house with Cox, right? So
Right.
I see a question was asked in the chat feature about that. And you're going to keep those as basically that's you and the legal team that's basically making that determination. Then that's outside of your policy. That's a judgment based on what might be the circumstances and the totality of those circumstances.
Yeah, security has a secure drive. Imagine that, security with a secure drive. And that's where we offload everything. And there are only a very small number of people that can get it. Even our legal department can't get into our secure drive. Now they can request and we can encrypt and send them video. But our policy as an organization is we don't release video to anyone, including police departments, until it's been subpoenaed.
Yeah.
And the reason for that is because our legal believe that if we started releasing video to the police departments, we would open ourselves up to the media and other avenues that might want video and would argue, well, why should we have to get a subpoena for this video when you're handing it away without any to others? So we've just taken the high road. It's a little bit of a pain in the neck for our police departments, but if they really want it, they can get you a subpoena in a pretty quick hurry.
Yeah, I think that's a good stance. I think that's one thing that is a great takeaway for everybody here, especially as the official stance. I know I've got a couple organizations I've partnered with over the years that have said, well, we won't release it officially without the subpoena, but if you had your own body worn camera and you want to see it for your own evidential review, we'll allow you to do that. But it's not an official release. It's only allowing them to see it and be able to make some understanding. But we're not officially reviewing, or excuse me, releasing that information. So, and I'm assuming that means the authorized person has to be you, risk management, legal. There are folks that are going
Right.
through that process, right? So,
You
but
know, Tony, you made me think of another thing. This is an example. We encourage our officers not to use the video as the sole tool for writing an incident report, because things happen in real time differently than they happen on video. You can go back and for example, you may have heard Billy Bob say, "Well, you stupid whatever," and you didn't hear it all. But when you listen to the body worn audio, you hear that he called you something really not nice, and you enter it into your report, which in itself is okay. But the best example I can give you is we had an incident where a gentleman was trying to get his girlfriend to leave AMA, and everybody believed the reason for that was because he had abused her, and she had been brought in by ambulance, and he wanted her out of the emergency department, and eventually he convinced her she should leave. Well, our officers were trying to run interference with this guy who was on speed, and he was just out of his mind. And outside the emergency department, he decided he was going to assault the officer, and he did. He took a couple big swipes at him. He didn't connect. The officer was able to win that encounter, and that gentleman went to jail. When we watched the body worn camera footage, so he was charged with simple assault. But when we watched the video, the body worn camera footage, and slowed it down to frame by frame, you could see there came a point where he took his keys and he slotted the key between his fingers to use it as a weapon. And we never saw that in the actual encounter. But when we reviewed the video, well, that in this case, now you've changed the level of assault that this individual tried to commit. And so in some places, it's good to use the video after the fact, as long as you denote that's where you got it from, because in real time, we never saw it. But then we went back to the police department. They said, "Oh yeah, we'll enhance the charge. You got the video, we'll subpoena it." And sure enough, really good.
Yeah.
Use.
Just another value for having it, right? To make certain. In how many of those events for those who haven't deployed that technology, have they been exposed to that we are just completely oblivious to, right? To hear that, but what you're thinking about now. I mean, one of the questions on the chat is, everybody at Cox Health who wears a security uniform, regardless of the role, is issued a body worn camera, or is it a subset?
Anybody who's in hard uniform that provides patrol services. So that takes it all the way up through our captains, who are working captains, lieutenants, sergeants, and our officers. Yes.
Yeah. So your supervisor, command staff, in addition to your frontline. Got it.
Right.
Thank you. So talk to us a little bit about the training. I mean, the tools that you've been able to deploy to really to make certain your documentation expectations are met, that the deployment is done. I mean, what elaborate on that for me a little bit.
Yeah. Well, it starts in the academy. And all of our new officers are introduced to body worn cameras, how they function, where you should position them on your body, when you should use them, how you use them as it relates to an incident report. What are the expectations? One of the things we task our officers with is doing what we call bookmarking video. So if an incident occurs, and we go in to look at John Smith's body-worn camera footage on the 21st, there'll be a big red flag up on the top. We don't have to go fishing. He's bookmarked that particular spot, knowing that this is from this point forward, you need to watch this video until it's over. And so, but training is an everyday process. It starts in our academy. It continues with our FTO program, and then they figure it out. They use it. If they have questions, we help them with it. But it's like any other training, it's ongoing until it's not necessary that it need to be ongoing. This becomes one of those, I think, high frequency, low risk training opportunities. We do it a lot. There's a low risk that they'll get it wrong. And so there comes a point where you don't have to spend as much time with it.
Certainly. Well, I mean, it sounds to me like it's like putting on your duty belt when you start your performance of your obligations, and really making certain that. And I loved what you said about the fobs earlier. So, you're not trying to handwrite and trying to connect dots on that. I mean, the intelligence has really come a long ways, and give my hats off to the manufacturers for just what they've done for convenience factor, right? I mean, take take make it easy, I guess is the
Yeah.
best way. Al, have you seen any AI out of the video that you're doing? I mean, is there any artificial intelligence that you're able to use when you're bringing all of these intelligence? I'm seeing a question coming across the chat, and I'm just curious if you. I would imagine with the video management software platform you're using, it's probably fed through that, so you're able to look for a few things. But I've not heard of anything in the past, so I'm just curious if I'm missing something on this end.
Well, I will say this, like any good system, there's plenty of data to be gathered that runs in the background. For example, we can tell you up to, by day, but we usually do it by month, how much a particular officer uses their camera, who's your high user, who's your low user, helps us identify, who might not be using the camera the way that it was laid out for them to use. You can determine when you're most likely to have body-worn camera footage by location. So there's data that you can get out of the system pretty easily. And we do that every month. Just, it's like the old inspect what you expect. We just take a look at it, make sure that we're using it the way we're supposed to.
Well, knowledge is power, and all of a sudden now you can start seeing it with the other trends and your events, and probably trying to say day of the week, time of the day. A lot of you get my brain just sort of flying just thinking about it. So, but it's interesting, Al. I want to sort of switch gears on the body worn camera. I know we've talked about the National Health Services over in London. I know Eric Clay, who's with IHSS, was just doing some work over there. I think he had a chance to do some keynoting, and been following him and hearing some of his reading. But they started deploying body-worn cameras outside of the security arena, specifically. They call them mental health wards. We would typically call them units here in the U.S., and a lot of my Canadian colleagues would probably be more accustomed to the ward saying. But it was all part of their government's violence reduction strategies. It's really pretty cool, and they did a pilot study. It's a few years old now, but it was published by the West London Trust, and it was pretty interesting. Some of the data that came from that. I mean, one. The pilot basically associated a significant reduction in the seriousness of incidents, which I thought was pretty interesting word choice, and especially with their admissions team. They said there was a very significant decline in the use of tranquilizing injections. So maybe in the States, most times we'll use that as when we administer medications, right?
Yeah.
Especially during restraint events and incidents. But they said it was really associated. The body-worn camera, they believe, was directly associated with reduction of the all seriousness of aggression and violence of reported events. And I thought that was fascinating. I mean, so we're starting now to see that the events themselves or the technologies being deployed elsewhere. So are you seeing technology like this? Are you deploying body worn cameras with others outside of the security team? Has there been any discussions? I mean, I don't want to have you giving away trade secrets or speak inappropriately here, but I'm just curious where are you guys' mind when it comes to outside of the protection program?
Well, we haven't yet, but there has been discussion, and I will tell you that we put a fixed, wide angle fixed cameras in a, a couple of our operating rooms in the emergency department to include audio, which is really an extension of that thought process you just had. They are using, and it's a turn on, turn off type of a system. So it's not always on, but in certain cases that they're going to evaluate closer, look back, see how they did, see where there may be opportunities for improvement. They're using this technology. They're just not. It isn't in a body worn camera. So I don't think we're far off from that happening, Tony. But we have not done it yet.
Yeah, I think I mean, the non-traditional uses. I mean, that's training, that's education tools that they're using in those
Right.
surgical suites, right? And as well as operational efficiencies, those that fall under that. I think I've talked to a lot of the quality leaders inside of healthcare who just absolutely love video surveillance. I don't. I've been encouraging a lot of our colleagues over the years. Hey, when you're getting ready to make this huge investment, you might want to go find out what other stakeholders might have a vested interest. You may find that those folks, in addition to occupational health and safety, those that are managing workplace injuries inside the org, et cetera, boy, they can be invaluable for placement as well as creating an ROI that just says, hey, it's what an advantage to have this type of capability inside the organization. But Alan, we're quickly coming to our time. But I'm thinking back to the guideline we worked on together with IHSS, and we talked a lot in this conversation about reputational risk, the legal considerations that need to be discussed. Um, but you were quoted in that particular press release that you think that body-worn cameras are going to be the standard equipment in most healthcare security programs in the next few years. I personally agree with that statement, but I mean, unpack that a little bit and from how many do you think are actually deploying the coverage? I'd love to hear from the audience how many actually have it right now, but I just curious what what you're thinking and what kind of timeline. And I'm asking you to be a little bit of Nostradamus right now, so I understand that you can't predict the future with 100% accuracy, but I'm curious by the thought process.
Well, our industry is doesn't have a lot of early adopters in it. People sit back and they watch, they listen, and then eventually they jump on board, and it's been that way for years. I'll just use the example of canines in healthcare. I mean, you think back about 3, 4, 5 years ago, how many canine programs were inside healthcare versus how many are there today? We have these special interest groups that talk about it all the time. They're popping up right and left, and I think body worn cameras is going to follow the same footprint. And in addition to the other reason they're going to follow is because the technology has gotten so much simpler and so much better. I can't explain to you the clarity of the video and the audio that we get. It leaves nothing to your imagination. And if you're going to deploy that type of technology, that's exactly what you want. Now, our organization will tell you, we recently had an incident, didn't involve our security, but it involved body worn cameras where they said, gosh, I wish we didn't have that recording. but we're an ethical organization and we have the recording, and it didn't shine favorably on some process that we were involved in. That's going to happen. But that's what you get with it. You got to take the good with the bad.
Well, we're dealing with humans, and humans are prone to make mistakes,
Yep.
and they're going to make errors. And unfortunately, you're not having a discerned technology that's saying, "Hey, don't record that." And I appreciate your terminology, and everything I've always heard about Cox Health is the integrity that's demonstrated, and I think that's pretty consistent with most healthcare organizations that I know I've been exposed to, and I think it's great. But Alan, it's one. I just want to say thanks for being a part, but I want to leave you with one last really good question. You've been a part of some 2+2 exercises with me over the years that we've known each other through IHSS and our past working lives. And I guess the question I would say is, knowing what you know now, would you do anything different in the rollout? Would you give any advice to those that are thinking about introducing body worn cameras in their program? Things that you can just say or lessons that you've learned. And I know you're a huge golfer, so if I gave you the breakfast ball, what would you do with it?
Well, first of all, I would encourage everybody to do their homework. Um, it's not like you're walking up to the C-suite or the legal department and asking them for, 20 more cameras here, there, or somewhere else. You're asking for something that may impact the way they do business, and has the ability to protect their reputation. However, there is some exposure. So you gotta do your homework. Uh, you might want to benchmark. There's plenty of us out here with model policies that we're more than happy to share. IHSS has a guideline. I think you get all your ducks in a row, and then you start walking down this path. And I can't encourage you enough to read the article that Tony referenced, which is in the Journal for Healthcare Protection Management. It's volume 36, number 1. If you want to know legally, if you're going to bump into a headwind with your legal department, this particular article will dispel a lot of what you may run into.
Yeah, I would agree. And, there's been some wonderful folks sitting out there. Bill is one. Al, your insights on this just are fantastic. I know that we got Ralph Cummings sitting out there that
Mhm.
has been just a phenomenal resource for a lot of folks over the years. But let me just say this to everyone. I know Alan for many years, sometimes longer than either one of us want to admit to one another. But in the same vein, um, he's always been a resource for those that are new to the industry or an old hand alike. And so if you have a question, reach out. I'm happy to help with that connection as well. But Alan, thanks for taking the time with spending with me and the audience today on a very important subject. Your insights, your perspective, not only are they useful, they're it just puts perspective into an understanding for everyone. And I just uh, you know what? I just say thank you for that, and I really appreciate it.
I,
Um,
you're welcome. You know me, Tony. I have no secrets, and I think that one of the things that I like most about our industry and the professionals that are in it is that we're willing to share. We don't have a lot of secrets. And I promise you, if you're thinking about it, somebody else is thinking about it, or they've already done it. And if you just reach out and ask, more than likely they'd be happy to share.
with one expectation and caveat, you share in return, right?
Yes.
That's the way the industry continues to grow and to get better together.
Yep.
Well, um, you're absolutely an advocate for this industry, and thanks again for joining me, Al. For those of you who are still on the line, please, we'd love you to complete a survey. Share what you like, share what you didn't. And we're continuously learning in every one of these exercises that we go through in these discussions. But also let us know what more topics you'd like to have this deep dive into. You've already heard Alan talk about canines. You've heard him talk about a lot of things here that are sitting out there in the master plan. But most importantly, Stay safe, stay diligent, and stay aware. And join me next month. I've got a fantastic guest lined up, Catherine Kate Schwett. She's a former head of the FBI active shooter program. She's a retired special agent, and she's the author of a book, Stop the Killing. And Kate's going to join me, and we're going to dive into the deep end on the issue of active assailants and hostile events that are occurring in healthcare. I think you're going to like what you hear from her, some of the no nonsense approaches that she's taking as it comes. And if you haven't ever heard her speak, I'm telling you, you're in for a treat, just like today, just like all the programs so far. So, with that, thank you. Take care, all. Bye bye.
Care, you guys.